Welcome back to the Deep Dive. Our mission today is, well, it's not just ambitious, it's pretty comprehensive. We're going to cut through all the noise of the latest wellness trends and dive really deep into the knowledge base of the forgotten home apothecary.
We really are.
We've got sources covering over 250 distinct preparations. I mean, everything from, gentle herbal teas to really potent tinctures and balms.
That's right. And for you, the listener, this deep dive is kind of your shortcut to confidence. We're moving past just the basic idea of natural remedies and really focusing on the crucial framework that lets you safely and confidently use nature's pharmacy.
Okay, so you're talking about the why behind it all.
Exactly. We're bridging centuries of traditional use with rigorous modern pharmacological research to understand the actual mechanism behind every single plant.
We've synthesized massive volumes of material for this. You got the time-honored practices from traditional herbalists like James Green and David Hoffman, but then we're blending that seamlessly with the clinical rigor and the safety guidelines demanded by practitioners like, say, Dr. Tiranona Lodog and Dr. Nicole Apelian.
Right.
The goal here is to find those aha moments, connecting that folk wisdom directly to the bioactive compounds and the scientific validation that proves they actually work. We'll start with the essential classification system before we dive into the hard chemistry and, of course, the critical safety protocols.
To manage this sheer breadth of 250 remedies, they're logically organized. They're put into 5 categories, and this is all based on the specific physiological systems they support.
And that classification is vital, I assume.
It is. It's vital for understanding effective, safe, and targeted use.
Okay, let's unpack this and dive right into the first category. This one is maybe the most fundamental for preventing illness in the first place: immune support and detoxification.
The core function here is really twofold. You're actively bolstering the immune system, and at the same time, you're supporting the body's natural clearance organs, we're talking about the liver and kidneys, to eliminate all that metabolic waste.
Okay, leading this category, we have one of the most celebrated antivirals in all the sources: elderberry, or Sambucus nigra. We all know it's used for cold, but can we get really specific about how it works?
Yes, and this is exactly where the science validates tradition. Elderberry is incredibly rich in something called anthocyanins. Those are the powerful deep purple pigments you see.
Right.
And studies suggest these compounds do 2 key things. First, they appear to inhibit the viral replication cycle itself. And second, they can physically block the virus's ability to attach to your host cells, particularly in the respiratory tract.
So it's both a defense and an offense.
It's both a protective shield and an immediate intervention. Using elderberry syrup isn't just about feeling better, it's about actively preventing the virus from taking hold in the first place, or, if it already has, significantly reducing the infection's severity.
So if elderberry is the shield, the sources often position Echinacea purpurea, as more of a proactive spear. What's its chemical distinction?
Well, Echinacea contains these really complex compounds called alkylamides. And these aren't just, boosting immunity in a general sense. They are specifically validated for stimulating the production and the activity of macrophages,
Which are a type of white blood cell.
a crucial type of white blood cell for engulfing pathogens. So when you take echinacea, especially in a tincture form right at the onset of symptoms, you're effectively sending in reinforcements to combat viral infections faster and more effectively.
And the sources are pretty clear on how to use it, right?
Very. They consistently recommend short, intense courses of use for the best results. They really distinguish between a preventive dose and an acute, I'm already sick dosage.
We also find ginger, Zingiber officinale here. Now, a lot of listeners might think of it for digestion, but what is its unique contribution to detoxification?
Ginger's role here comes from 2 key components: those warming compounds, gingerols, and shogalls. Now, these are anti-inflammatory, yes, but crucially, they are very strong circulatory stimulants.
So they get the blood moving.
They get everything moving. By enhancing blood flow, ginger helps the lymphatic system and the whole circulatory system move accumulated metabolic waste and toxins out of the tissues and get them to the clearance organs more efficiently. A simple fresh ginger tea is like a powerful, non-aggressive kickstart for your entire system.
And finally, in this category, the powerhouse that literally grows in everyone's backyard: Dandelion, Taraxacum officinale. We need to know the mechanism behind its liver and kidney support.
Dandelion is absolutely essential for true detoxification. It contains these compounds called sesquiterpene lactones, particularly one called taraxacin.
Okay.
These compounds are known as choleretics. That's a fancy word, but it just means they specifically stimulate the production and flow of bile from the liver and gallbladder. And bile is critical for flushing out toxins.
So it's working directly on the liver.
Directly. And then the leaves act as a gentle diuretic, helping the kidneys eliminate excess fluid and waste. So the root, usually roasted and used as a tea, is your primary liver supporter, while the leaves are generally for the kidneys. You're not adding anything, you're just strengthening the body's own sophisticated plumbing system.
Moving on to our second category, skincare and beauty. The sources make a really crucial observation here. The skin is our largest organ, and its health is always a reflection of what's going on inside.
That's absolutely right. The herbs in this group work to soothe topical irritation, promote rapid cell regeneration, and importantly, address any underlying inflammation.
So let's start with Calendula officinalis. This is pretty much the gold standard for topical wound healing. Why? What's going on there?
Calendula is rich in triterpenoids, saponins, and flavonoids. These compounds literally accelerate cellular proliferation and tissue repair. So when you use it in a salve or an ointment, it doesn't just soothe the area. It actively reduces inflammation and helps to organize the tissue structure as it heals.
Which is why it's so good for scarring.
Exactly. That's why it's so effective at preventing scarring after minor burns, cuts, and scrapes. It's an absolute staple for any home first aid kit.
And if we're looking for more long-term skin support, both inside and out, rosehip oil from Rosacana really stands out. It has a pretty unique chemical profile.
It really does. Rosehip oil is a fatty acid powerhouse, specifically high in linoleic and linolenic acids. But its real magic, I think, comes from its concentration of natural vitamins A. We're talking retinoic acid precursors and vitamin C.
And those are the building blocks for collagen.
They are crucial cofactors in collagen synthesis. This is why consistent application or even ingestion helps improve skin elasticity, significantly reduces the appearance of wrinkles, and can even help heal older scars by encouraging that tissue turnover.
Everyone knows lavender, Lavandula angustifolia for its scent.
Yeah.
But what are its specific validated skin applications beyond just, aromatherapy?
Topically, the main active compounds, linalool and linyl acetate, provide powerful antiseptic and anti-inflammatory properties. This makes diluted lavender essential oil really effective for soothing conditions like acne, eczema, and minor rashes.
And there's that stress connection too.
A huge connection. The sources emphasize that its calming scent reduces the underlying stress hormone response, which is often a key driver for flare-ups in conditions like eczema. So it works on two levels.
And aloe vera, Aloe barbadensis Miller, the cooling hero.
Of course. Aloe vera gel contains complex polysaccharides and glycoproteins. These work synergistically to provide deep moisturizing and that immediate cooling relief we all know, making it the definitive remedy for sunburns.
And it's more than just cooling.
Much more. The glycoproteins accelerate the healing process by promoting tissue regeneration and reducing the inflammatory response, ensuring that the healing is quicker and a lot less painful.
That brings us to category 3, digestive health. And it's so true. If the gut isn't happy, nothing is.
Absolutely. The gut is central to overall wellness. The remedies here are all focused on mitigating inflammation, addressing spasms, and balancing the gut environment.
Peppermint, Mentha piperita, is probably the most recognized remedy here. Can you explain its antispasmodic action? What does that mean?
So peppermint's primary active ingredient is menthol. When you drink it as a tea or take a tincture, that menthol works by relaxing the smooth muscles that line your digestive tract.
I see.
This antispasmodic effect directly relieves the painful spasms we associate with things like irritable bowel syndrome or IBS, indigestion, and just general stomach cramps. It allows trapped gas to pass and just calms an irritated system.
And for those specific issues like excess gas and bloating, we turn to fennel.
Fennel seeds, Feniculum vulgare, are true carminatives. Their volatile oils, primarily a compound called anihol, help to break up and expel gas from the digestive tract. This alleviates that painful bloating and indigestion.
So you can just chew the seeds.
You can.
Yeah.
The seeds can be chewed directly or prepared as a strong tea after meals, and it provides really rapid relief from discomfort.
And finally, we have chamomile, Metricaria chamomilla. Its relaxing properties are well known, but how does that chemically translate to the digestive system?
Chamomile contains compounds like bisabol and chamazulene. These are potent anti-inflammatory agents that work directly on the gut lining, reducing irritation and any mucosal damage.
Ah, so it's not just a general calming effect.
No, it's targeted. So while the tea provides that overall mental relaxation, chemically, it's delivering a soothing anti-inflammatory action right where it's needed, helping to calm an overactive or irritated digestive tract and easing discomfort that's associated with stress.
Let's move to category 4, pain relief and relaxation. Here we're looking for accessible, natural compounds that can mimic pharmaceutical actions, but without the, heavy chemical load.
And turmeric, curcuma longa, is the subject of just a massive amount of clinical research today.
It really is. Turmeric is famous for its powerful anti-inflammatory action, specifically because of compounds called curcuminoids. It targets those inflammatory pathways, which makes it a powerful choice for chronic pain, things like joint pain, arthritis, and general muscle soreness.
And the preparation is key.
Crucially, the sources all stress that turmeric has to be consumed with a fat, and ideally with black pepper to enhance its absorption. We'll get into the details of that in part 2.
Then we have a really remarkable historical remedy in willow bark, Salix alba.
Willow bark is truly nature's aspirin. It contains salicin, which your body metabolizes into salicylic acid, the active anti-inflammatory component in synthetic aspirin.
So it's the same end product.
Essentially, yes. This makes a willow bark tea or tincture highly effective for headaches, muscle pain, and fever reduction. However, because your body has to do that work of metabolizing the salicin, its onset of action is generally a bit slower than aspirin, but the relief is often longer lasting and much gentler on the stomach.
And for addressing muscle tension that's rooted in stress, valerian root, Valeriana officinalis, is an incredibly powerful sedative.
Valerian root promotes relaxation and reduces anxiety primarily through something called valerianic acid. This compound is believed to interact with the GABA neurotransmitter system in the brain, which is similar to how some anti-anxiety medications work.
So it's promoting deep calm.
Exactly. Promoting deep calm, aiding in sleep disorders, and relaxing tense muscles.
Our fifth and final category is respiratory health. We all need tools for clearing airways, soothing inflamed tissue, and fighting pathogens in the lungs.
And Eucalyptus globulus, is the clear leader for decongestion.
Yes. Its primary active compound is cineol, a powerful volatile oil. When you inhale it through steam, cineol acts as a really robust mucolytic, which just means it breaks down mucus and an expectorant, helping the body expel it.
That is fast.
It provides instant relief from nasal congestion and helps clear the bronchial tubes during a chest cold.
Then we can look to mullein, Verbascum thapsus, a traditional lung health hero, especially for those dry, irritating coughs.
Mullein is exceptional because it has two key components, mucilage and saponins. The mucilage is a soothing, gelatinous substance that literally coats and calms the irritated mucosal lining of your throat and lungs.
In the saponins.
The saponins act as mild expectorants, helping to loosen and mobilize thick, sticky mucus. So mullein tea is highly recommended for conditions like asthma, bronchitis, and those persistent dry coughs.
And finally, thyme. Thymus vulgaris, just a common kitchen herb that holds some impressive power.
It really does. Thyme contains strong volatile oils, primarily thymol and carvacrol. These compounds are highly antiseptic but also powerful expectorants. A strong thyme tea or syrup helps loosen mucus and soothe inflamed airways, providing proven antibacterial support while easing those persistent coughs you get with respiratory infections.
Okay, let's unpack this a bit more. We've reviewed the categories, but before anyone rushes into the practical preparation, the sources stress, and I mean really stress, that understanding why these remedies work is the difference between a successful deep dive and just a superficial summary.
Absolutely.
This is where we stop just listing herbs and we start exploring the hard science.
Indeed. The efficacy of these 250 remedies is rooted entirely in plant chemistry. Herbal medicine relies on what we call bioactive compounds or phytochemicals. If you can understand these, you understand the medicine.
Right. Let's get into the specifics of these chemical components. What are some of the critical classes of compounds that are delivering these benefits?
We should focus on three major groups. First, you have alkaloids. These are nitrogen-containing organic compounds, and they often have really profound pharmacological effects, sometimes quite similar to pharmaceutical drugs.
Like caffeine?
Exactly. Think of caffeine or even morphine as examples. In the context of our sources, the alkaloids, or similar structures like the alkylamides and echinacea, are often responsible for the strong anti-inflammatory or immune-modulating responses. They require really precise dosing because they're so potent.
And second, the often cited flavonoids. We heard they are in chamomile and rosehip. What are they structurally doing in the body?
Flavonoids are polyphenolic compounds. They're essentially plant pigments, and they are powerful, powerful antioxidants. Their primary job in the body is to neutralize free radicals, which reduces oxidative stress and systemic inflammation.
So that's why they're so protective.
That's exactly why herbs rich in flavonoids like chamomile or lavender offer these generalized protective effects for the skin, the digestive system, and even the cardiovascular system.
Okay, third, let's look at terpenoids and saponins. These seem to play really diverse roles, from scent to healing.
They do. Terpenoids include the volatile oils that give herbs like eucalyptus and lavender their strong aroma and their antiseptic properties. They're often responsible for those immediate effects, like clearing congestion.
And saponins.
Saponins, on the other hand, are sort of detergent-like compounds. You often find them in roots, like wild yam. They can help with absorption, but they also have profound effects, like maleic saponins acting as mild expectorants, helping to emulsify and loosen mucus. Research validates why these specific structures deliver specific benefits. It grounds the traditional use in observable chemical action.
So understanding the mechanism is really everything, and the science isn't just dismissing centuries of traditional knowledge. It seems to be actively reinforcing it.
Precisely. This connection between centuries of traditional use, what we call ethnobotany, and modern scientific findings is absolutely critical. The sources, especially drawing from the work of Dr. Nicole Apelian, stress that we study how Native Americans used elderberry or how the Romans used lavender because this historical track record is an immense body of empirical evidence.
But I have to ask, how do the sources address the skepticism that often surrounds historical remedies? Is the modern research truly comprehensive? Or is there a risk of, confirmation bias, just validating the uses we already expect to find?
That's a vital, critical question. And the sources are very clear that modern research must adhere to double-blind, randomized controlled trials. While ethnobotany provides the hypothesis, the research has to prove the mechanism beyond just anecdotal use.
Can you give an example?
Sure, when they study St. John's wort for depression, they aren't relying on old Roman texts. They're studying its active compounds, hyperuricin and hyperforin, and their effects on neurotransmitter reuptake. That's a process verified in rigorous, peer-reviewed clinical trials that you can find published in databases like PubMed. This standard of proof is what elevates the home apothecary from folk remedy to evidence-based practice.
This leads us directly to the second pillar, primary sources and credibility. If we're relying on rigorous science, what kind of information should you, the listener, be prioritizing?
You have to prioritize authoritative, specialized sources. For detailed herb profiles, preparation guides, and correct dosages, you must rely on comprehensive, professionally vetted herbals, something like the Herbal Medicine Maker's Handbook by James Green. It's non-negotiable.
Why those specifically?
Because these resources are compiled by experienced practitioners, and they detail both the traditional use and the toxicological data.
And how do we evaluate the sheer credibility of the sources we might find online or elsewhere?
You have to research the credentials of the authors. Are they recognized medical doctors who specialize in integrative medicine like Tirona Lodog? Or are they clinical herbalists with decades of experience like David Hoffman?
And if you find conflicting information,
You cross-check it across multiple credible sources. If, say, the American Herbal Products Association and a peer-reviewed journal agree on an herb's properties or its safety profile, you can treat that data as highly reliable.
before we move on to safety, we have to address a really crucial point. The difference between preparation methods. We keep mentioning teas, infusions, decoctions, tinctures. Can you break down the chemical necessity? I mean, why do we simmer roots but we only steep leaves?
This is fundamental chemistry. The preparation method is dictated entirely by the plant part and its molecular structure.
Okay, so let's start with an infusion, a tea.
An infusion, or tea, is for your delicate plant parts, leaves, flowers, and things with volatile oils, like chamomile or holy basil. Their active compounds are easily soluble in hot water, but they're often heat sensitive. Too much heat will destroy them, so we just steep them for 5–10 minutes.
And a decoction.
A decoction is for the dense, tough plant materials, roots, bark, and berries. Think wild yam, licorice root, or ginger. Their active compounds are locked inside tough cellulose structures. We have to simmer them, which means slow boiling for anywhere from 20 minutes to an hour, to break down those cell walls and extract the alkaloids or saponins we need.
And tinctures are different again.
Tinctures use alcohol, often 40-80 proof vodka or grain alcohol, to extract compounds that just don't dissolve well in water, like many resins and specific alkaloids. They are highly concentrated, and you dose them in drops, not cups.
That makes perfect sense. The preparation technique is simply maximizing the bioavailability of the phytochemicals you're trying to get.
Exactly. It's just applied chemistry.
This brings us to the most critical section, safety and toxicology. This is the non-negotiable requirement for becoming your own herbalist. If we're dealing with potent plant chemistry, we have to respect the potential dangers.
Absolutely. The powerful compounds mean that dosage and duration of use are vital. Too much of a good thing is, in fact, dangerous. We have to highlight some specific toxicological risks mentioned in the sources.
Let's link the toxicity back to the chemistry. Why, for example, is something like comfrey dangerous to take internally?
Comfrey contains pyrrolizidine alkaloids, or PAs. Now, comfrey preparations like poultices are safe for external use on unbroken skin, but internal consumption, even in small amounts over time, can cause severe liver damage. It works by blocking blood flow in the hepatic veins.
Wow.
It's a classic example of an herb with powerful external healing properties, but very clear internal toxicity due to a specific alkaloid group.
And what about kava, which is often used for anxiety?
Kava, or Piper methysticum, has been linked to potential liver toxicity. The research is still ongoing to identify the exact mechanism and differentiate between, poor quality supplements and the traditional preparations. But the warning is crucial. If you have a pre-existing liver condition or you consume alcohol frequently, you should strictly avoid kava.
And we mentioned a common one in part 1, licorice root. How does something so common cause high blood pressure?
Licorice root contains a compound called glycyrrhizin. Structurally, glycyrrhizin mimics the action of aldosterone, which is a hormone that regulates your salt and water balance.
So it tricks the body?
It does. Consuming high amounts of licorice over long periods causes your body to retain sodium and excrete potassium. This leads to water retention, high blood pressure, and sometimes even heart rhythm issues. So internal use must be short-term and avoided entirely if you have pre-existing hypertension. The chemical link is undeniable.
Okay, here's where it gets really interesting and potentially very complicated. Herb-drug interactions. We have to be meticulous here because herbs don't just exist in a vacuum. They interact profoundly with pharmaceuticals.
This is perhaps the most crucial takeaway. The chemical compounds in herbs can either inhibit or induce your liver enzymes, particularly the cytochrome P450 enzymes, or CYP450.
And those are the enzymes that process most drugs.
They're responsible for metabolizing about 75% of all prescription drugs. If an herb speeds up or induces these enzymes, the drug is metabolized too fast and loses its effectiveness. If it slows down or inhibits these enzymes, the drug can accumulate to toxic levels.
Let's look at the classic interactions. How does St. John's wort achieve this enzyme interaction?
St. John's wort is a classic enzyme inducer. Its components speed up that P450 pathway. This means if you are taking antidepressants, oral contraceptives, chemotherapy drugs, or HIV medications, St. John's wort will often cause those drugs to be metabolized so quickly that they become ineffective.
Which could be life-threatening.
For someone relying on these medications, this interaction can absolutely be life-threatening. The safety advice is simple. You must consult a healthcare provider before combining St. John's wort with any prescription drug.
What about more common kitchen herbs? Let's talk about garlic and blood thinners.
Garlic, especially in high supplemental doses, contains sulfur compounds that have proven antiplatelet effects. That means they interfere with blood clotting. If a person is already on an anticoagulant medication like warfarin, a blood thinner, the combination can dramatically increase the risk of bleeding or hemorrhage.
Even just from food.
Even high culinary intake needs to be monitored very closely in those situations.
Okay, moving to modern integration and synergy. Herbal medicine today isn't just an alternative. The sources show a real necessity for interdisciplinary collaboration, the kind of approach championed by Dr. Nicole Apelian.
Right. This modern holistic approach demands collaboration between botanists, pharmacologists, chemists, and medical professionals. A pharmacologist analyzes the mechanism of action, while a botanist ensures correct species identification and compound purity.
And that integration is key.
It's crucial for generating safe, standardized remedies, and is becoming more and more important in integrating herbal medicine with conventional treatments, especially for managing complex chronic diseases.
And the principle of synergy is so interesting. It highlights that herbs often work better together than they do alone.
Synergy is the chemical sweet spot. The classic, most research-validated example is combining turmeric and black pepper. Turmeric's active compound, curcumin, is poorly bioavailable on its own. It's poorly absorbed by the gut, and it's rapidly metabolized by the liver.
So you don't get much of it.
Not much at all. But black pepper contains piperine, which dramatically increases the bioavailability of curcumin by inhibiting certain liver enzymes that are responsible for breaking it down. Adding piperine, just a pinch of black pepper, can boost curcumin absorption by up to 2,000%.
2,000%.
It's the perfect illustration of intentional chemical synergy in herbal preparation.
And finally, these global trends seem to confirm that the demand for natural alternatives is just rising.
Absolutely. And as science continues to validate these traditional practices, the focus shifts to creating standardized, researched remedies that can safely complement or integrate with conventional treatments. We're moving away from purely anecdotal use towards evidence-based natural health.
Now, we take that rigorous foundation of phytochemistry and safety, and we apply it to some highly detailed preparation examples. We need to look closely at the methodology and, critically, tie the safety warnings back to those chemical concepts we just discussed.
Let's start with hormonal balance and adaptogens. These often involve those dense root materials, so they're going to require decoction or encapsulation.
And first up is the wild yam and black cohosh tonic, #1 in the sources.
Yes, this blend is highly beneficial during menopause or hormonal fluctuations because both of these roots contain phytoestrogens. These are compounds that mimic estrogen in the body, which helps to smooth those transitions.
Let's talk about the required preparation detail. How do you actually do it?
So, because these are dense, fibrous roots, the preparation is a decoction. You have to combine the dried, cut and sifted roots with cold water, bring it to a boil, and then you simmer it gently for a full 20 minutes before you strain it and cool it. That heat and that time are absolutely essential to break down the dense cellular structure and extract the saponins and phytoestrogenic compounds.
And the critical safety note here is paramount, given that hormonal effect.
Given their phytoestrogenic activity, you must strictly avoid this tonic if you are pregnant, breastfeeding, or actively using hormone therapy or prescription birth control. Introducing outside hormonal mimics can cause serious complications, which just underscores the necessity of talking to your doctor before you start using it.
Next up, the popular adaptogen blend, ashwagandha and holy basil. That's #5. These are usually consumed as a tea or a powder to combat chronic stress and fatigue.
For a tea, this is an infusion. You just steep the powdered ashwagandha root and holy basil leaves in hot water for only about 5 to 7 minutes. Ashwagandha, Withania somnifera, helps regulate cortisol levels.
But there's a serious safety caution here as well.
A critical one. Avoid if pregnant. Ashwagandha is known to possess mild abortifacient properties in high doses and may stimulate uterine contractions. Also, its immune-modulating action means it's often contraindicated for individuals with severe autoimmune conditions where you really don't want that kind of stimulation.
And the sources also highlight chisandra berry and rhodiola root capsules, which is #86, and this demonstrates the encapsulation technique.
Right, and this is the appropriate delivery method for standardized dosing or for things that just have an unpleasant flavor. You have to grind the dried chisandra berries and rhodiola root into a very fine powder first. Then, using a small capsule machine or just filling them by hand, you fill empty vegetarian capsules.
And how do you take them?
You typically take one capsule in the morning to reduce stress and increase energy, and the safety note is the same as before: avoid during pregnancy.
Okay, switching gears to respiratory and throat health. These preparations often involve syrups or steams for more direct application.
We have the mullein and coltsfoot cough syrup, #2. This is a two-step preparation. Step 1 is a decoction of the mullein and coltsfoot leaves or flowers to extract that soothing mucilage.
And step 2,
You simmer these gently, you strain them thoroughly, and then, once the liquid has cooled down, you mix it with honey and a little apple cider vinegar. The honey acts as a preservative and also as a soothing demulcent.
we mentioned the age restriction for honey earlier. Why is this repeated so rigorously in all the sources?
The safety note is absolute. It must be avoided in children under 2 years old due to the risk of infant botulism. This is not a risk from the herbs themselves, but it's a critical food safety protocol related to unpasteurized honey. Also, you should avoid this if you're allergic to ragweed, as both mullein and coltsfoot are in that same plant family, the Asteraceae family.
Another immediate technique involves the sage and thyme respiratory cleansing steam, which is #29.
This utilizes the potent volatile oils, thymol and cineol. You just add a generous handful of the dried herbs to a bowl of freshly boiled water. Then you put a towel over your head and the bowl, and you inhale the steam for 10–15 minutes.
So it delivers it right to the source.
It delivers the decongestant and antiseptic compounds directly to the sinuses and airways. Safety note. Avoid if you have known sensitive airways or severe asthma, as those highly concentrated volatile oils can sometimes be irritating if you inhale them too aggressively.
And for throat inflammation, let's look at the ginger and licorice root sore throat syrup, number 23.
The preparation involves a strong decoction. You're simmering fresh sliced ginger and licorice root for a good 30 minutes, then straining it and mixing it with honey. But as we detailed in part 2, this recipe carries a major safety warning.
Let's repeat it.
You must crucially avoid this if you have high blood pressure. This is due to the hypertensive effects of licorice root's glycyrrhizin on your body's mineralocorticoid receptors.
Our third practical category is topical and skincare, utilizing oils and balms for localized absorption.
We have the St. John's wort and lavender oil anxiety relief blend, which is number 7. This is simply mixing the essential oils with a carrier oil like jojoba or coconut oil and massaging it onto pulse points or tense muscles.
This preparation contains 2 of the most significant safety warnings in the entire apothecary. We need to detail them again.
Yes, the chemical risks are high here. First, St. John's wort contains hypericin, which is responsible for an effect known as phototoxicity. After you use it topically, you must avoid direct sunlight for at least 12 hours. It can cause severe sunburn and skin irritation.
And the second warning.
Second, as we discussed, St. John's wort is a notorious enzyme inducer. It may dramatically interact with antidepressants or any medications that affect serotonin levels, and that's regardless of whether it's taken internally or absorbed through the skin.
For general first aid, there's the coconut and honey antiseptic balm, number 19.
This is a really practical formulation. It combines coconut oil for its fatty acids and moisturizing properties, honey for its natural antiseptic action, and a few drops of tea tree oil for its powerful antimicrobial terpenes.
What's the safety protocol here?
The primary safety protocol for any new topical blend is to perform a patch test. Put a little on a small, discrete area of skin 24 hours before you use it generally, just to make sure you don't have an allergic or hypersensitivity reaction.
And the simple yet potent turmeric and coconut oil anti-inflammatory balm, number 125, for localized pain.
This is simply a paste that you apply directly to inflamed joints or muscles. It's a very effective way to deliver high concentrations of curcumin topically. While it's generally safe, the practical safety note is crucial. Turmeric is a powerful dye.
It stains everything.
It will stain your clothes, your bedding, and it can potentially leave a temporary yellow tint on your skin. Also, you should avoid applying this potent mixture to any open cuts or broken skin.
Finally, let's look at detoxification and liver support, which are often prepared as teas and smoothies for consistent internal cleansing.
The classic combination here is the dandelion root and milk thistle liver detox tea, which is number 57. This involves a decoction of the roots. Milk thistle, Silybum marianum, contains silymarin, which is a complex flavonoid that protects liver cells from damage and aids in their regeneration.
And the safety note.
The essential safety note here is for the allergic listener. Avoid if you are allergic to plants in the daisy family, the Asteraceae family. That includes both milk thistle and dandelion, and cross-reactivity is very common.
For a potent daily cleanse, the sources mentioned the cilantro and turmeric detox smoothie, number 21.
This blend utilizes cilantro, which is often studied for its heavy metal chelating properties, turmeric, lemon juice, cucumber, and coconut water. It offers daily anti-inflammatory and cleansing benefits. Safety-wise, it's generally low risk.
But there's a but.
But the high acidity from the lemon and the pungency of cayenne pepper, if you add it for an extra boost, mean it's not suitable for individuals with sensitive digestive systems, severe GERD, or pre-existing ulcers.
And the cayenne pepper and lemon circulation booster, number 25.
This involves drinking cayenne pepper and lemon juice in warm water daily. Cayenne contains capsaicin, which dramatically increases circulation and metabolism. But given the extreme heat, this is strictly not suitable for individuals with active digestive issues, severe acid reflux, or ulcers, as the capsaicin can severely irritate a compromised stomach or intestinal lining.
Okay, here's where it gets really interesting. So we've talked about the science, we talked about the safety, but now we get to see how these remedies translate from complex chemistry into tangible, immediate human experience.
Yeah.
These real-world applications provided in the sources make the effects just incredibly memorable for you, the listener.
They really do. These anecdotal accounts highlight the speed and the localized efficacy of plant-based remedies. They often provide relief that feels almost miraculous when you experience it.
Let's start with examples of almost immediate relief. The sources talk about eucalyptus oil being an instant game changer for severe seasonal congestion.
Yes, one really compelling account detailed a listener who was suffering from severe hay fever. They used eucalyptus oil in a steam inhalation, and they reported that the congestion, which had been blocking their sinuses for hours, cleared up noticeably within 2 minutes of starting the steam.
2 minutes.
That just speaks to the intense, localized efficacy of cineol as a potent mucolytic agent.
And for acute pain, the rapid effect of peppermint oil on migraines is also very compelling.
A case study of a chronic migraine sufferer reported rubbing diluted peppermint oil focusing on that high menthol content onto their temples and the back of their neck. They noted that the throbbing pain started to ease within 5 minutes. This suggests the menthol provided a fast, topical analgesic and cooling effect that mitigated the vascular components of the headache.
Perhaps the most surprising example of immediate topical relief is clove oil for a severe toothache.
Clove oil is an old traditional remedy for a reason. It contains a very high concentration of eugenol, which is a natural analgesic and antiseptic. Applying just a minute amount directly to the painful area instantly numbed the toothache.
So it's a temporary fix.
It's temporary, but this powerful localized anesthesia offers crucial relief and really highlights the chemical power you can find in common spices.
And for external use on irritation, aloe vera remains the unparalleled rapid soother.
An anecdote recalled a severe kitchen burn where cold, fresh aloe vera gel was applied immediately. Not only did it instantly halt the burning sensation because of its cooling polysaccharides, but the redness and blistering were significantly mitigated overnight. It just demonstrates its profound ability to support rapid cell regeneration.
Beyond these immediate fixes, the sources provide evidence of herbs supporting the management of chronic conditions, where consistent use leverages the cumulative anti-inflammatory or systemic effects, starting with turmeric for arthritis.
A listener reported integrating a daily dose of turmeric, carefully combined with black pepper for maximum bioavailability to manage their knee arthritis. They reported that over a 3-month period, they experienced noticeable reductions in swelling, joint stiffness, and discomfort.
Which illustrates that systemic effect.
Exactly. The powerful systemic anti-inflammatory potential of curcumin when it's properly absorbed.
And cinnamon for blood sugar control. That's a pretty impactful claim for a kitchen spice.
A case study mentioned an individual with prediabetes who began incorporating a daily cinnamon powder capsule. They noted, in conjunction with their physician, a significant stabilization and reduction in their fasting blood sugar levels. It's not a cure, but it highlights the validated potential of cinnamon's active compounds to enhance insulin sensitivity and glucose metabolism.
Even persistent, frustrating issues like chronic dandruff can be addressed simply.
Right. Apple cider vinegar, used consistently as a weekly scalp rinse, cleared up years of chronic dandruff for one person. This suggests that the acidic properties of ACV were effective in balancing the scalp's pH and eliminating the mild fungal overgrowth, often malassezia, that drives that persistent flaking.
Finally, let's touch on the holistic and wellness benefits that leverage the connection between scent, chemistry, and cognition. I love the anecdote about rosemary oil in focus.
A university student reported diffusing rosemary oil while studying for exams. They credited the practice with improved focus and memory retention. And this aligns with research suggesting that the active volatile compounds in rosemary, when you inhale them, interact directly with pathways linked to cognitive performance.
So it shows how scent can be leveraged for daily mental tasks.
For sure. And for pervasive issues like chronic fatigue. A user of ginseng supplements reported a profound lift in persistent fatigue. They noted a noticeable increase in sustained energy levels and mental stamina after just 2 weeks of consistent use, which really validates the adaptogenic quality of ginseng in helping the body manage stress and stabilize energy.
These comprehensive accounts just remind us that these 250 remedies are not historical curiosities. They are effective, accessible, and scientifically grounded tools for profound real-life wellness and self-care.
We have completed a pretty comprehensive exploration of the forgotten home apothecary. We've detailed the science behind 5 major categories of remedies, everything from the antiviral potency of elderberry to the systemic safety warnings surrounding licorice root. We've really emphasized that true knowledge is only valuable when the mechanism is understood and the application is managed safely.
It's so true.
And the rigorous research process ensures that these time-honored practices align perfectly with evidence-based modern science.
Absolutely. So you now have a high-level understanding of the categories, the chemical necessity of preparation techniques. I
Yeah.
mean, understanding why we decoct roots but we infuse leaves. And, most importantly, the non-negotiable safety protocols. Things like the phototoxicity risk of St. John's wort and the hypertensive risk of licorice root. This knowledge really empowers you to reclaim wellness naturally, safely, and confidently.
And as we conclude, the sources, particularly those focused on long-term sustainable wellness, like Dr. Apelian's work, stress one final critical point. It connects your personal health directly to the planetary ecosystem.
So, what does this all mean for you as you integrate this practice into your life? The focus on creating a home apothecary inherently highlights the importance of sustainability in herbal medicine. It's the ethical necessity of using wild-crafted or organically grown herbs and prioritizing local sourcing whenever you possibly can.
Right.
Moving forward, consider the ecological footprint of your personal pharmacy. How can embracing the forgotten home apothecary also lead you toward becoming a more mindful, sustainable steward of nature's powerful gifts? That is something for you to mull over and explore on your own.